Hey, all right, y'all. I had to record this. I'm sorry. I looked at the case studies for Monday and they're like 45 minutes long, so I really don't have time to cover this. And then we have two different topics: tobacco and nicotine, which is a big lecture on Wednesday, and then inhalants on Friday. I just don't see how I can do this in person. So it's only a couple of slides. It's not that big a deal. We're basically combining what we talked about the last 2 days with alcohol and its effects with last week's talk on addiction, right? So, how does alcoholism work? And so, as I mentioned in class, all three models actually apply to alcoholism. Physical dependence, absolutely have withdrawal symptoms. People continue to use alcohol to avoid the negative effects of withdrawal. Disease, there are definitely hereditable genes that increase the susceptibility to alcoholism. In fact, animal models demonstrate that, right? So here we take a group of rats and we give them alcohol and we give them water. And the ones that prefer to drink the alcohol, we breed them together. And the ones that don't prefer alcohol, we breed them together. And then the next generation here, next data point, we give those offspring alcohol and water and continue to separate them based on the behavioral phenotype. So we're always breeding alcohol preferring rats together, always breeding non-alcohol preferring rats together. And over generations, we create a strain of rats that has a very strong preference for alcohol compared to the normal rats. And so essentially by inbreeding these rats that prefer alcohol, we're consolidating the genes that are involved with that preference. You could do the same thing for spicy foods. You could do this for anything, right? Any kind of preference. Continue breeding the animals that have that similar preference, and you're consolidating whatever's controlling that preference, right? All right. And then finally, positive reinforcement. Certainly, the formation of alcohol is probably primarily driven by positive reinforcement. People are consuming alcohol for its relaxation, stress relieving, self medicating, social interaction benefits of it. All right. Okay, so there is a reduction in negative consequences when people are under the influence of alcohol, right? So this is the stress relieving. So whatever's negative in your life, the consuming alcohol provides a positive reinforcement because it reduces those negative consequences. Plus, it's socially acceptable to some degree. So, it's widely available at all stores. You go to a dinner, and the first thing the waitress or waiter asks you is, "Would you like something to drink?" And so, this is part of society, if you will. All right. So, alcoholism, there are two different sort of classes of alcoholism: type 1 and type 2, or type A and type B. The 1 and A and the 2 and B are kind of interchangeable there. Let's look at type 1 or A first. Okay, this has less of a genetic influence, so because of that, it equally affects men and women. It's a gradual development, and it develops in different time courses in terms of different ages, depending on that person's use. When do they start heavily using alcohol? It's generally a less severe form of alcoholism. It's more likely to be a binge problem where people have remorse, where they will overconsume and then have remorse and maybe go for a period of time of not overconsuming and then they overconsume again, this sort of thing. Type 2 is fundamentally different. It has a strong genetic component. This is the one that affects men more than women. It has a rapid development around age in the early 20s, which coincides with when people first really start experimenting and using alcohol. So, genetic predisposition, as soon as you start using alcohol, this addiction starts to develop. It tends to be more severe, a steady problem. These are the people that wake up in the morning and start drinking, and they drink until they go to bed at night, and they have much less remorse, guilt, or fear about this problem. And it's much harder to treat as well, and obviously more significant um, chronic effects on their bodies. Okay, alcoholism treatments. Type 1 or type A alcoholics do show some responsiveness to SSRIs that are increasing serotonin in their treatments. And so this may suggest a fundamental difference in um, the circuits that are involved with the binge sort of non-genetic addiction component compared to the genetically linked addiction component, right? So probably different neurological bases of these types of alcoholism. Okay, so there are some drug treatments that have shown some promise for helping with certain aspects of recovery from alcoholism. So the first is this drug, Atoll, which helps with uh, glutamate release, the inappropriate glutamate release that's happening during withdrawal. So it's a specific treatment to help with withdrawal effects. So over here we see that the control animals down here, and then we see animals that are going through withdrawal, and we see the percent of baseline glutamate being released. So we see there's this increase in glutamate, and we don't exactly know the mechanisms of action of this drug, but we know it's acting on NMDA and calcium channels in some way. And so when animals are on this drug, they don't show this increase in glutamate release. So it says it's a glutamate agonist, but it's actually preventing the overstimulation or the release of glutamate during withdrawal. The second drug is naltrexone. We mentioned that. This is an opioid antagonist, and this can help after withdrawal to help prevent relapse. So here we see percent of people that are relapsing with therapy and naltrexone, and that we're seeing much fewer, right? So the higher line is only 80% of the people way out here at 12 weeks are relapsing, compared to placebo with therapy, where we're down to 30% of the patients have not relapsed. Not relapsed. Okay, so it turns out that if you take both of these drugs together, it works out even better, right? So we're now working on the withdrawal effects and maintaining abstinence through a reduction in cravings. And so this top line, again, patients abstaining from relapse, about over 50% with a combination of drugs. Either drug by itself is better than placebo. All right. So this additive effect, the fact that these drugs can add together, shows that they're acting through different mechanisms, an opioid mechanism and a glutamate mechanism. All right, so again, one of the things that we said, what's the importance of these addiction models, is that it can help with prevention and treatment. So if we look at the disease model, we say you have this genetic background that predisposes you to addiction. There's no way to change that. We don't have a medicine that can treat it, and so abstinence is the best treatment. You just can't expose yourself to alcohol because you have this disease state, right? Alcoholics Anonymous is a great social support group that helps people maintain that abstinence through sponsors and through meetings and through sharing their experiences. For physical dependence, we talked about things like Atoll, the drug we just talked about, that can help with withdrawal, also helping people through sedation and sort of make it through that 7 to 10 day period so that they can be clean and go and work on the therapeutic parts. The therapeutic parts are, why were you drinking? Like, what was the cause? What was the positive reinforcement? How can we substitute something healthy for that, right? Antabuse that we mentioned, that blocks that second rate limiting step of metabolism in the liver, so that you get, with one drink, a big buildup of acetaldehyde that makes you feel sick, right? It's clinically a little bit less effective, meaning that, it works as long as the patient continues to take the antabuse, but if the patient really wants to relapse, they simply stop taking their pills, and then when they drink, they don't get sick, right? There's been some experimentation in blocking some of the rewarding effects, so that bupiron or Wellbutrin is one of those drugs that has been prescribed for that. But again, really the biggest therapeutic way is through cognitive behavioral therapy or psychotherapy to do behavioral modification to change why the person was consuming the alcohol, to unlearn the conditioned um, place and person preferences that are associated with that addiction, and to give them effective coping skills to remain abstinent. All right, I told you it wouldn't be long. Not on Friday, on Monday, we are going to do alcohol case studies. So come ready. I'll have a handout for you to fill out just like we did for addiction. Have a great weekend.